When we think of assessing and treating the foot, it is common to focus on things like ankle mobility or arch control and things like hyperpronation. But when we're talking about assessing the foot, we need to remember that the toes play a very critical and essential role as well. Yet the toes are so often neglected and forgotten about, and this is going to be a big problem. Remember, with walking and running gait, as the heel lifts, the body weight is going to shift towards the toes. So if there's dysfunction here, this can really translate into a number of issues and potential injuries at the foot itself, as well as up the kinetic chain. And remember, the muscles that flex and extend the toes live in the foot itself. All right, so assessment of the toes is also a very important and effective way to assess for proper muscle function within the foot itself. So in this video, we are going to go over a simple assessment procedure to assess for proper function of the toes. All right, so let's review the tests that we're going to use to assess for toe function. And here what we're really looking to assess is simply whether or not the toes are healthy and are capable of working the way they need to in order to support proper and ideal foot function. So here there's going to be four basic things that we need to assess. And these four things tie back to our movement hierarchy, which outlines the basic attributes that each and every joint in our body needs to be capable of doing to be considered healthy and functional. Now, I've talked about this in more detail in past videos and in our online courses, but just to quickly review, the four key components of the movement hierarchy include movement tolerance, joint coordination and motor control, flexibility, and finally muscle strength and endurance. So let's take a look at how to assess each of these. So to set this up, we can have the patient seated or standing, and what we want is to have their foot elevated up on something. I find a yoga block works really effectively for this. So what we want is the heel to be flat, and we want the ball of the foot through that metatarsal area to be resting on the block, but the toes are going to be hanging over the block so they're free to move. And what we're simply going to have the patient do is just simply flex the toes down as far as possible, hold for a moment, and then extend the toes up as far as possible, keeping the heel and keeping that metatarsal area flat on the block. And the first thing that we're looking for here is simply whether or not this motion causes symptoms. All right, so if this is going to be painful, we're going to classify these patients as being movement intolerant. And if this is the case, this is going to be a big problem, right? Because it means that there's something going on into those toes and into that forefoot and metatarsal area. And clearing that sensitivity is going to be one of the main priorities that we're going to start with our treatment program. All right, so the second thing that we need to look for beyond tolerance to the movement is coordination and motor control. So here we can simply have the patient just do all the toes up and down as we did before, and we're simply looking to see are they able to create that motion and activate those muscles that flex and extend the toes. But the other thing to keep in mind here is we want to assess the ability to control the independent motion of the big toe and the four smaller toes. Right? Keep in mind anatomically that these areas have distinct muscles and anatomy that controls flexion extension, as well as different nerve networks that are going to speak to and coordinate that motion. So we do want to sort of assess to see whether or not the ability to control these movements independently is present as well. So here we're simply going to have the patient try to alternate. So we're going to have them try to flex the smaller toes down while they're lifting the big toe up in kind of a scissoring motion. And then we can do the opposite. So this big toe is coming down and the small toes are coming up. And you can see in this case, so just try to go back and forth as best you can. So in this case, you can see there's some independence, but not a lot. So in this case, this is a difficult thing for this patient to do. So what we're going to have to do is put developing coordination on our treatment plan in order to try to improve the function of the toes and improve the motor control of the muscle networks in the toes here. And just as a quick addition before we move on, ideally what we want to see here is a really smooth ability of the patient to separate that big toe and those four lesser toes. We see the ability to alternate flexion and extension through those segments. right? And we see the motion occurs in an isolated way. It occurs through the toes and through the metatarsophalangeal joints without a lot of excessive motion through the arch and through the foot and through the ankle. All right, so after control, we can look simply at flexibility. And again, we can simply have the patient press down as far as possible, lift up as far as possible. And now we're looking to see how much range is in the toes, and particularly how much range is in this metatarsal joint here, all right? Because this is going to be what's really critical to create that bend and create that motion during the gait cycle. And again, we can have them do it actively, but we can also do this passively. All right, so as the toes are pressing down, we can also create a little bit of overpressure to see how much give there's going to be in the toes. And what we're really looking for here is how much angulation we're going to have between the initial toes here, between this proximal phalanx and the metatarsal joints here. And what we typically want to see is a pretty big angle between that section. We want this interphalangeal joint here to be well below the metatarsal joint in this case. And what you're going to see very often with people with metatarsal problems, for example, metatarsalgia is a big one, is that that motion simply won't be the case. There's going to be a lot of tightness on the dorsal part of the foot, and they're going to be losing a lot and missing a lot of motion in through there. Now, the other thing to keep in mind here is, as we talked about just a moment ago, we want to think of the toes as two separate structures, as a big toe and as the lesser toes. So when we're assessing flexibility, we do want to be careful to assess those things in both of those sections and independently. So again, as we're pressing down, we can press on those lesser toes, but we can also press on that big toe to make sure that joint has some motion and has some give through those structures. And of course, we're going to do the same thing for toe extension. So here the patient is going to lift the toes up, but again, we can use some overpressure to see how much flexibility that there's going to be here and how much resistance there is to that extension. When we're talking about the lesser toes, again, we want those toes to get fairly high up here. We want to make sure there's adequate extensibility in the joint capsules of the metatarsals. But remember, this is also a window into the muscles on the bottom of the foot, into those short flexors, the flexor hallucis, the flexor digitorum brevis when we're talking about the smaller toes. But again, for that big toe, that's going to be a really important assessment to see how high that big toe can get up. That's going to be a key component of proper gait. And when that's tight in through there, that's going to be an indication that we need to see where that tightness is coming from. Is it from the joint capsule, perhaps from the plantar fascia, or some of those short or even long hallucis flexors that we might need to consider? Lastly, we want to check the strength and the endurance of some of these muscles. And again, this is going to be really critical, especially for toe flexion, right? Because a lot of those short toe flexors, again, particularly the flexor hallucis brevis, the flexor digitorum brevis, these are going to be really critical plantar foot muscles. They are very important to stabilize the foot and to stabilize the arch. And we need to make sure that there's adequate strength and endurance of these muscles. So in this case, again, we're simply going to have the patient flex those toes down as far as possible, and we're going to have them hold that position, hold that flexion, but we can use our hand to come up underneath the toes. We can gently stabilize the dorsal part of the foot here, and we're simply going to tell the patient not to let us pull those toes up. So we're simply going to try to pull into extension, right, and have the patient resist. And again, we can do this assessment on the lesser toes, but we can also do the same thing on that big toe to check adequate strength of those first hallux flexors here. Now, in this case, the resistance is pretty good, but what you will very often see here is as you're trying to, if you push down, as you try to kind of pull up, you often will get just the inability to hold that position. And what you will very often see is you're going to get extension of that metatarsal joint. So oftentimes, because the long flexors go all the way down, you'll allow the toes, the interphalangeal joints, to stay flexed, but you'll have this kind of motion where you can almost see where the toes want to come up like this and extend through that joint there. And that's going to be an indication that there's some significant weakness in through those digital flexors on the bottom of the foot. And again, when that's the case, we are going to want to put that into our programming and put that into our treatment plan to try to correct those deficiencies. So that's going to be our go-to test that we're going to use to assess function of the toes and of the metatarsal joints. And as you can see from that fairly quick and fairly brief procedure, we can get a ton of information and insight as to what's going on in through the toes and in through the forefoot. Remember, both from the first toe perspective, which is really critical, but also from those lesser toes as well. And then from there, that's a key jumping off point that we can use to direct our treatment, right? Because based on the areas of dysfunction that we find with that test, we're then going to plug something into our treatment plan in order to correct those various areas of dysfunction, depending on what they may be. And again, this may certainly be some manual therapy that we're going to apply, but it's also going to be part of our key exercise prescription. And what I'm going to do is in subsequent follow-up videos, we're going to go over all of the different exercises that we can use to plug into our treatment plan based on the specific area of dysfunction we find, right? So that's whether there's going to be a movement tolerance and a pain situation that we need to clear, whether it's going to be mobility, whether it's going to be flexibility, whether it's going to be motor control, or whether it's going to be strength, right? So we can really use this test as an effective way to tell us exactly what we need to do from a treatment perspective.